We think we've got something which is a fantastic tool to scale globally and internationally, and we're incredibly ambitious about that. So my name's Debbie Wake. I'm a clinician by background and academic researcher and CEO for MyWay Digital Health. Our main focus is around developing digital tools that support people with long-term conditions, with a particular focus around diabetes. And what we've got with diabetes is this window of opportunity between when someone develops the condition and potentially down the line the risk of complications. If we can, at the right point in time, introduce the right therapies, the right medication, the right treatments, which we know exactly what they are, there's good guidelines to tell us what to do, but also if we can get patients better self-managing in that space, then we can completely avoid the downstream complications. 80% of the cost sits with these downstream complications, yet most of them are completely preventable. So in terms of KTN, they're probably an underutilised resource, and my experience and interaction with them has been fantastic. So I think going back to the very first SBRI award that we wrote for Innovate UK, I come from a very academic background. I'm used to writing research grants. If you're writing an application for Innovate UK, a standard research grant application is not going to fly, it's not going to work. I remember the first time we did this, sending something into KTN and getting some feedback on that and getting amazing feedback that absolutely was crystal clear in terms of what we should be doing, what we should be aiming for, and what Innovate UK is really looking for in these applications. And I've got no doubt that that led to the first success in terms of our Innovate UK funding. The Women in Innovation Award has been fantastic, I think, from a personal point of view, because it's really supported me in my kind of personal development from academic and physician through to somebody who's scaling, running a business, trying to achieve global impact. It's given a bit of extra funding, particularly in a key area of product development, that's allowed us to start delivering notifications and alerts through our system to really do that kind of push support back to patients, and that's been key for product development. But I think more important than that, it's opened us to a lot of support and guidance from KTN around what else is out there to help us, both in terms of mentors, potential for investment, other funding streams as well. And we've now applied for and successfully achieved some other funding, which is going to help us think about the international expansion. So I think for anyone who's thinking about applying for Women in Innovation, I would first of all wholeheartedly advise them to apply. If you're not sure, though, seek advice, seek help, because there's lots of people out there who will be very happy to talk you through the application, what it's about, what you're going to get out of it, how to increase your chances of success. And also I think what they've done really well is that there's a programme of activities and a network that develops out of the back of that. So it taps into a whole wider area of support and knowledge through KTN, of things like webinars and other sort of educational opportunities that fall out the back of that. So you'll still have access to lots of ongoing opportunities and things. So I'd say go for it, but don't be scared to ask for help and support and advice. Lots of people there who will encourage you along the way.